Welcome to Better English.
Speak English with confidence.
In this video, you will master the English you need at the doctor's office. Listen, repeat, and speak. We are going to learn useful health vocabulary for your daily English. This is a very important topic for your A2 level journey.
Yes, we want you to feel comfortable when you go to the doctor. Welcome to our lesson.
Hello everyone, I am David. Today is day 10 of our 30-day shadowing and daily practice series. We are very happy you are here to practice your speaking skills with us.
I am so excited for day 10. Hello, David. It is a beautiful day to learn some useful health vocabulary.
Before we start, let's talk about our method. First, listen to us talk. Then, repeat the sentences after us to practice your shadowing. This helps you speak more naturally and builds your confidence.
That is the best way to learn. Listen first, then repeat. It builds your muscle memory for speaking.
That is right. Shadowing is simple. You hear me say a sentence, and then you say it exactly like I do. We will do this many times today so you can remember the words easily.
It is fun, too. You do not have to think about grammar. You just have to copy the sound of our voices.
Visiting a doctor can be a little scary when you are in another country. You might worry about the words you need. But do not worry, we will practice the most common phrases together.
I agree. It is much easier to get help when you know the right sentences to say to the nurse or the doctor.
Our first shadowing sentence is a very simple greeting. Listen first. Hello, doctor, I am not feeling well today. Now repeat it after me. Hello, doctor, I am not feeling well today.
That is a perfect start. It is a polite and clear way to begin your conversation with any medical professional.
That was great. Remember, we will say the shadowing sentences 2 times. This gives you time to listen to my voice, and then time to try the pronunciation yourself.
Yes, do not rush. Take your time to really hear the pronunciation and the rhythm of the English language.
Are you ready to start part 1? We are going to talk about how to get to the doctor's office and what to say when you arrive at the reception desk.
I am ready. I think our listeners are ready too. Let's learn how to make that first phone call to the clinic.
The first step is always the phone call. You need to call the clinic to book a time. This is called an appointment. Grace, do you find it difficult to call a doctor on the phone?
Yes, I do. It can be a little stressful to speak English on the phone because you cannot see the person's hands.
I agree. On the phone, you cannot see the person's face, but the receptionist is usually very helpful. They will ask for your name and why you need to see the doctor today.
That makes me feel better. It is good to remember that the receptionist wants to help you get the care you need.
Exactly. Here is a very common sentence you will use on the phone. Listen. I would like to make an appointment, please. Now, it is your turn to repeat. I would like to make an appointment, please.
That is a very useful sentence. It is very polite. Everyone should know how to say that correctly.
Very good. If it is not an emergency, you can ask for a specific day. For example, you can ask if the doctor is available tomorrow or later in the week.
Good point. Usually, it is just for a checkup, or because we have a small problem like a cold or a cough.
That is a great question. Let's practice asking about the doctor's schedule. Listen, is the doctor free tomorrow morning? Now, say it with me. Is the doctor free tomorrow morning?
That is a great question to ask. It helps you plan your day. It is important to be on time for the doctor.
Once you arrive at the clinic, you usually see a desk. This is the reception desk. You need to tell the staff that you are there for your scheduled visit.
The reception desk is the first thing you see. It is usually right by the front door when you walk in.
That is correct. You should give them your name and the time of your visit. Listen, my name is David, and I have an appointment at 10 o'clock. Now, repeat, my name is David, and I have an appointment at 10 o'clock.
I like that sentence. It is very clear. The receptionist will be happy because you are giving all the information quickly.
The receptionist might ask for your insurance card. This is a small card that shows you have health insurance. It is very important to have this with you at all times.
Oh, I always have my insurance card in my bag. It is very important for the clinic to have that information.
Now, the receptionist will tell you to sit down in the waiting room. This is the room where patients wait for the nurse to call their name. Sometimes you have to wait for a few minutes.
The waiting room is usually very quiet. It is a good time to relax and look at your notes for the doctor.
That happens often. If you are waiting a long time, you can ask a question. Listen, how much longer is the wait? Now repeat after me. How much longer is the wait?
That is a very polite way to ask. Sometimes the receptionist can tell you if the doctor is running behind schedule.
Now we are inside the room with the doctor. The doctor will usually start by asking a question like, "How can I help you today?" Or, "What seems to be the problem?"
That is the big moment. You have to explain why you are there. This is when we use our symptom words.
That is right. A symptom is a sign that you are sick, like a cough or a fever. We usually start our sentences with "I have a" or "I feel" to describe them.
Symptom is a big word, but it just means how you feel. It helps the doctor understand your health.
Let's practice a very common one. Listen, I have a bad headache today. Now repeat after me. I have a bad headache today.
Those are very simple and effective. A headache can be very painful, so it is important to tell the doctor.
A headache is very common, but another frequent problem is a stomach ache. If your stomach hurts, you need to tell the doctor exactly when the pain happens.
That is true. A stomach ache can be caused by many things. The doctor will want to know when it started.
Yes, hurts is a very useful word. Let's practice using it. Listen, my stomach hurts after I eat. Now, please repeat, my stomach hurts after I eat.
Using the word hurts is perfect for A2 learners. It is a very easy way to show the doctor where the problem is.
The doctor might also check if you have a fever. A fever is when your body temperature is too high. It usually means your body is fighting an illness.
Yes, and a fever usually means your body is trying to fight off a sickness. It is an important sign.
Exactly. Let's practice that sentence. Listen, I think I have a high fever. Now it is your turn. I think I have a high fever.
Great job repeating that. Make sure you say high fever so the doctor knows it is serious.
Sometimes we do not have a specific pain, but we have no energy. In this case, we can use words like tired or weak to explain how we feel.
Sometimes you just want to sleep all day. That is a symptom too. It is your body telling you it needs to rest.
That is a good way to put it. Let's practice saying you feel weak. Listen, I feel very weak and tired lately. Now repeat after me. I feel very weak and tired lately.
That is a common feeling when you have the flu. It is good to let the doctor know you have no energy.
What about a cold? In the winter, many people get a sore throat and a cough. Let's practice that. Listen, I have a sore throat and a cough. Now repeat, I have a sore throat and a cough.
Our list is growing. These are all the words you need to describe a common cold or the flu.
After you explain your symptoms, the doctor needs to check your body. They might use a stethoscope to listen to your heart and your lungs while you sit on the table.
The examination room is usually very clean and bright. The doctor uses their tools to look for more clues.
The doctor will ask you to do certain things. For example, they might ask you to breathe deeply. This helps them hear if your lungs are clear or if you have a cold.
Taking a deep breath helps the doctor hear your lungs clearly. It is a very common instruction in the office.
Breathe is an important verb here. Let's practice this instruction. Listen, please take a deep breath for me. Now repeat after me. Please take a deep breath for me.
Yes, breathe is a very important word. Practicing this helps you stay calm when the doctor is checking you.
The doctor might also want to look at your throat with a small light. They will ask you to open your mouth very wide and say, "Ah."
Yes, they use a small light to see if your throat is red or swollen. That is how they check for infections.
Let's practice that sentence. Listen, open your mouth and say, "Ah." Now it is your turn. Open your mouth and say, "Ah."
Ah is a funny sound to make, but it helps the doctor see everything in the back of your mouth.
Another thing the doctor checks is your blood pressure. They put a band around your arm. It feels a little tight for a moment, but it is a very important test.
Blood pressure is very important for your heart health. Most doctors check this every time you visit.
Let's practice a sentence about this checkup. Listen, I need to check your blood pressure now. Now, please repeat. I need to check your blood pressure now.
That is a very professional sentence. You might hear the nurse say that even before you see the doctor.
The doctor will also ask questions about your daily habits, like how much you exercise or how many hours of sleep you get each night.
Our lifestyle is part of our health. What we do every day affects how we feel in our bodies.
Sleeping is very important for your health. Let's practice this question. Listen, how many hours do you sleep every night? Now, say it with me. How many hours do you sleep every night?
That is a great question to practice. It uses how many, which is very important for A2 learners to master.
If you have a specific pain, the doctor might touch your back or stomach and ask, "Does it hurt here?" You should answer yes or no clearly.
They are checking your body. They want to see if there is any pain when they press on different areas.
The doctor has finished the exam and now they will tell you the results. This is called the diagnosis. They will also give you advice to help you get better at home.
This is the part everyone waits for. We want to know what is happening and how to fix it.
Rest is the most common advice. Your body needs energy to heal. Let's practice this sentence. Listen, you need to stay in bed and rest. Now, repeat after me. You need to stay in bed and rest.
Staying in bed is hard if you like to be busy, but your body needs that time to heal itself.
Another common piece of advice is to drink a lot of fluids, like water, tea, or juice. Let's practice this. Listen, drink plenty of water and rest. Now please repeat, drink plenty of water and rest.
Water is like medicine for your body. It helps you stay hydrated and helps your immune system work.
The doctor might tell you to stay home from work or school for a few days. This helps you recover and prevents other people from getting sick.
That is good advice. You should not push yourself when you are sick. You need to give yourself permission to stop.
Let's practice that. Listen, do not go to work until you feel better. Now it is your turn. Do not go to work until you feel better.
That is a very caring sentence. It shows the doctor wants you to take care of yourself before returning to work.
Sometimes the doctor says your problem is not serious, which is great news. They might say, it is just a small cold and you will be fine soon.
That is always such a relief to hear. You feel like a heavy weight has been lifted off your shoulders.
Let's practice hearing that good news. Listen, it is not serious, you will feel better soon. Now say it with me. It is not serious, you will feel better soon.
That is a very kind thing to say. It is encouraging. It makes the patient feel much more positive about their health.
If the doctor uses a word you do not know, do not be afraid to ask them to explain. It is very important that you understand the medical advice.
Never feel embarrassed to ask for help. English is a big language, and medical words can be very tricky.
That is a very helpful phrase for all English learners. Let's practice it. Listen, could you please repeat that more slowly? Now repeat, could you please repeat that more slowly?
That is my favorite phrase. I use it all the time when I am learning a new language. It is so useful.
That is perfect. Now we are ready for the final part. We will talk about prescriptions and how to get your medicine at the pharmacy.
We are almost there. Only one more part to go. Let's talk about the pharmacy.
The last thing the doctor gives you is a prescription. This is a document that tells the pharmacist exactly which medicine you need and how to take it.
The prescription is your ticket to getting the medicine you need. It is a very important document.
You take that paper to a pharmacy. The pharmacist will give you the pills or the liquid medicine. They will also explain the dosage, like twice a day.
The timing is everything. Some medicines work better in the morning and some work better at night.
Let's practice a sentence about taking your medicine. Listen, take one pill every morning after you eat. Now, repeat after me. Take one pill every morning after you eat.
That is a very clear instruction. Practicing this helps you understand the pharmacist when they give you your bottle.
If you are worried about how the medicine will make you feel, you can ask about side effects. Let's practice that. Listen, does this medicine have any side effects? Now please repeat, does this medicine have any side effects?
Asking about side effects shows that you are being careful with your health. It is a very smart question to ask.
Well done, everyone. You have finished day 10. If you finished this lesson, please type "I did it" in the comments below. We love seeing your hard work.
Yes, type, "I did it." It is a small way to celebrate your success. You are one step closer to your goal.
Thank you so much for practicing with us. If you liked this video, please click the like button and subscribe to Better English for more daily lessons.
We appreciate all of you. Your support means the world to us. We love building this community together.
Tomorrow is day 11. We are going to learn how to ask for directions. The title is Day 11, Asking for Directions Travel English Shadowing.
Asking for directions is so important when you are traveling. You do not want to get lost in a new city.
It is going to be a very useful lesson for your next vacation. Goodbye for now, and keep practicing your English every day.
Have a wonderful day, everyone. See you tomorrow for day 11. Goodbye.
Your English journey does not end here. Watch more videos and keep practicing.